Welcome to the Compounding Center Connections, where we talk about different health conditions with our partnered practitioners. I'm your host, Jay Gill, the owner and a compounding pharmacist from the Compounding Center in Leesburg, Virginia. At the Compounding Center, we collaborate with practitioners, create custom medications to help our patients get better. In today's episode, I have Dr. Suzette Mikula from the Department of Otolaryngology at the Georgetown University Medical Center. Welcome, Dr. Mikula.
Thank you, Jay, for inviting me.
Thank you for joining us for this talk, Dr. Mikula. And the talk today is on chronic sinus infections. Could you please introduce yourself to the listeners?
Yes, my name is Dr. Suzette Mikula. I work at Georgetown University Hospital in the Department of Otolaryngology. My specialty area is rhinology, which includes disorder of the nose and sinuses, allergy, facial plastics, and sleep medicine as well.
Great. So, you and I have worked together for many years, and ENT has become one of our specialties that we at the pharmacy support ENT throughout the DC, Maryland, Virginia area. And could you explain to our listeners what causes sinus infections and how do they become chronic?
Yes, there are many different causes for sinus infections, but one of the most common ones is a viral infection. So it's a common cold that goes on and does not clear up. If it's an acute infection, it's something that will last less than a month, 4 weeks in duration. If it's more than 3 months, it's considered a chronic inflammation. So there's a difference between a chronic inflammation is something where inside the sinuses, the lining inside the sinuses is inflamed, and that can predispose patients to getting what we call acute on top of chronic infections.
Can you explain where are the sinuses for our viewers and listeners, and what is the actual function of the sinus cavities?
Well, the sinus cavities are in the head, and we have 4 cavities on each side. We have sinuses behind our cheeks. These are called the maxillary sinuses. We have sinuses in between our eyes. These are called the ethmoid sinuses. We have sinuses behind our eyebrows, which are called the frontal sinuses. And then we have sinuses that are behind our ethmoid sinuses at our base of skull called our sphenoid sinuses. The function of the sinuses has been somewhat unknown, but in general, I would say the purpose of the sinuses is to help with balancing the weight of the head because they are hollow cavities. And it's not really a humidification of air, but it adds to, I suppose, a defense against infection, although there are patients who are more susceptible to getting these infections, and sometimes that can have to do with anatomical variation.
Gotcha. And, I always get calls at the pharmacy sometimes that, that there's a lot of mucus buildup in the sinuses. How does that kind of happen for someone? Or maybe my question should be like, how is someone prone to get sinus infections?
Well, patients who have chronic inflammation inside their sinuses are probably more prone to getting sinus infections, acute sinus infections. If they catch a cold, like I said before, they can get an acute on top of a chronic infection. Patients who have who are immunocompromised, who have autoimmune conditions, often are more prone to getting sinus infections. Patients with significant allergies, where the sinus cavities become very swollen during allergy seasons, and they're not on any allergy medication, or the medication that they're taking is not effective, can often get recurrent acute sinus infections. There are, exposure to pollutants in the air. Chronic exposure to pollutants in the air can cause reactivity of the lining of the sinuses. There are numerous other causes for it. So those are some of the common reasons.
Gotcha. So, as a otolaryngologist, do you recommend any type of preventative or sinus health type to your patients to say, if you do this throughout the years, you can minimize the number of infections, or, just be preventative in nature, essentially? Like sinus rinses over the
So
counter
once
with
we
that?
know patients, so once we know patients are getting these infections, yes, we often do recommend that they do over-the-counter rinses, using salt packets that can contain baking soda, and also distilled water, because there have been instances where people have irrigated their sinuses and gotten other infections from, say, using well water.
Oh,
But we do recommend that, when we have patients who are prone to getting these infections, which can also be from sick contacts. I have patients who are teachers, and when they're working in the schools, they are exposed to children, kids. A lot of kids carry germs, and they end up getting infected for whatever reason. And so when we know that they have this situation, or like during cold flu season, when there are a lot of viruses out there, we do have them do these irrigations, or sometimes saline moisturization, over-the-counter nasal saline sprays, things like that.
gotcha. So I know personally, I get season allergies, and a few years ago, I started the plan. I really start like a month before I start doing my sinus rinses. It helps me
Hmm.
not have that
Hmm.
congestion, so they do really
Hmm.
work. Um,
Hmm.
One of the other
Hmm.
questions I always get is that nasal polyps. Okay, I know we're talking about
Hmm. Hmm.
sinus infections, but could you explain to the listeners
Hmm.
what are nasal polyps and how do they grow?
So nasal polyps are not cancerous. I'll just start out by saying that, because polyps in the colon, can be precancerous, but in the sinus cavity, they are not usually cancerous. They're benign. But basically, it's an inflammatory condition that can occur in certain groups of patients. There's a group of patients that are sensitive to aspirin. These are known as aspirin exacerbate. They have aspirin exacerbated respiratory disease, and these patients have polyps. They have aspirin sensitivity, and they have asthma. So polyps in this group of patients is very common. There are patients who have what we call allergic fungal sinusitis, and this is not an invasive fungal infection. This is something where the patient is very allergic to fungus, and they have mucosal reactivity. The swelling gets so bad that they produce these polyps. And it's almost like an autoimmune condition. And it's a condition that is a lifelong condition, basically. There are other patients who can develop polyps for no apparent reason. We've been studying this. There's a lot of studies going on, and we don't always know what causes some patients to have polyps, especially if they test negative for allergies or they don't fall into this aspirin exacerbated respiratory disease group. There are some other groups too that are more prone, but these are some of the more common ones. So it's a challenge in some cases taking care of some patients with these conditions.
Gotcha. So, sometimes I get a question or a patient will mention to us that they have undergone sinus surgery. Could you explain to us, like, how how do you decide, or what factors decide surgery over, let's say, rinses, some other kind of treatments that you're talking about, like oral antibiotic rinses and things like that?
So patients that we take to surgery are those who have tried and failed prolonged courses of conservative treatment. So conservative treatment would include prolonged courses of oral antibiotics, topical steroid sprays or topical steroid rinses, antihistamines. These patients have chronic sinusitis as seen on their CAT scan, and they probably also have recurrent acute infections, which is why they've been treated with these multiple courses of prolonged antibiotics.
Can someone after surgery still get infection or polyps to grow back?
Yes, and that is one of the risks for patients with polyps, that the polyps can grow back, absolutely. And so these topical rinses that we do, especially the ones that we have patients order from the compounding center that contain a topical steroid called budesonide or mometasone, can be very effective in preventing these polyps or slowing down the growth of these polyps.
Gotcha. And how?
Patients can also get recurrent, oh, sorry.
No, 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 go ahead, go
Patients,
ahead.
but I just wanted to also say that there are other patients who have recurrent bacterial infections that can be acute or prolonged. And in some of these patients where they have very resistant bacteria, they can't maybe take a certain class of antibiotics, or maybe, the antibiotics are just not working. We don't want to give them intravenous antibiotics. We try these topical irrigations containing antibiotics and steroids to at least keep these infections from getting worse, or just like treating them and keeping them from developing. So
How long?
they're very helpful.
Gotcha. And sorry, there's a little bit of delay, so I don't mean to interrupt accidentally. How long does someone have to be
It's
on a
okay.
sinus rinse?
So for patients who, it's very patient individual. This is the way I treat it. I usually have patients who have very resistant bacteria. I at least keep them on a topical antibiotic for 3 months. For patients who get bacterial infections or prone to get bacterial infections during cold flu season, I usually keep them on something during the cold flu season, and then they go off it after that season is over. So there are some patients who have autoimmune or immunodeficient conditions where we try to take them off of it, and they just get infected no matter what we do. So in some of those patients, very few, we keep them on it long term.
Gotcha. So one last question, and it's regarding COVID. And during this time, have you come across any patients with loss of smell? Because that has become a indicator for COVID-19. So any suggestions?
Yes. I have come across some patients who have had a loss of smell secondary to COVID. Now, usually the loss of smell resolves within 3 weeks to 3 months. But if it is not responding, then we can try some topical steroid sprays, particularly one that reaches the olfactory cleft, or we can also, or because we can do this in conjunction, we can try smell training with essential oils.
Gotcha. Well, a lot of information that you have discussed with us today. Thank you very much. Um, I just wanted
You're
to
welcome.
mention that everything that is discussed today is for informational purposes only, not for diagnosis or treatment.
Okay.
So, Dr. Mikula,
Right.
if someone wanted to reach out to you and consult with you, where can you be reached, or how can someone reach you?
So they can call the hospital, Georgetown University Hospital. Our department number is 202-444-8186. I am at Georgetown, but I am also at an outreach clinic in McLean, Virginia. And so we do have a central scheduling service. And when they call, they can let the central scheduler know where they prefer to have their appointment. We do see patients, as I said, in Virginia and also at Georgetown.
Great. And I will make sure in the descriptions we have the links to both the sites listed. Thank you,
Thank you.
everyone, for joining
Thank
us.
you.
I can be reached at j@compoundingcenter.com. If you have any questions or comments, feel free to reach out to me. Thank you.